some cream on my lip for cold sore. So I want to talk to you about my near-death experiences. I was just watching a MASH episode tonight when Winchester got a real wake-up call how close he was to death when he saw 2 bullet holes in the back of his head. Just missed his head by a fraction. So I'm going to talk to you about my near-death experience when I was drinking too much booze too fast, and I was at a very young age. I was 16 years old. I'm not going to tell you how I got to that point because I don't want to give anybody any ideas on how to do anything because it's not recommended. However, I'm going to tell you how it felt. I remember being in the back of a car when we were cruising, and I remember taking my last few sips of cherry whiskey. And then all of a sudden I remember feeling really sick. And then I remember my head leaning over onto the side of the car. And then I remember somebody calling out my name. And it really sounded like it was from a distance. A really far distance. I could still hear them, though. I couldn't see anything at this point. I don't know if my eyes were closed or if everything had blacked out. But my vision was gone. But I could always hear. I always heard. And I remember them talking to me, my friend talking to me. I remember knowing who it was that was talking to me, but I couldn't respond and I couldn't answer. I know that I was moaning and crying for a few minutes, and then I went into this peaceful state. And my head was on the side. I didn't feel any sickness. I didn't feel anything. It felt like I was going further and further away from my body. It's the only way that I can explain it. And I know that I was going into a comatose state. My friend kept talking to me constantly, nonstop, like, Julie, wake up. And she started saying, you can't, nothing can happen to you. You have to hang on. She kept telling me to hang on. That I had a lot to live for, and that there was a boy that I really liked, and she kept talking about him, even though I know nothing was going to be happening with him. Before that moment, when I was really out of it, they were trying to, I don't know if it was before or after, I think they took me out to an area out in the countryside, and it was raining that night, so they tried to get me to stand up, and they were dragging me. One had me on each arm, and I felt like a rag doll, and I was unresponsive, and they were dragging me in the mud and the cold, and it was cold out and rainy, and I got all wet, and then they put me back in the car because they wanted to sober me up. They didn't want to take me home in that condition because, frankly, my friend was afraid of my mother. So if she brought me home in that kind of condition, my mother wouldn't have been too happy. Anyways, eventually, I don't know how long later, I remember hearing her talking to me the whole time. And then I remember them dragging me. It felt like it was dead weight that they were lifting because they had a real difficult time. And I was only like 120 or 130 pounds or whatever. But at this point I wasn't speaking. They pulled me out of the car, put me into a wheelchair. I don't know who exactly because I couldn't see that point. They got me into the hospital. I remember hearing another voice, which I'm assuming was the ER doctor, saying to me, did she take anything? Did she have anything? What did you see her take? Blah, blah, blah. And assumed that I had overdosed in something. And so he was calling for my name, but I was unresponsive. I remember him starting to wheel me into the back of the room, and then all I remember is being in this. I don't remember anything that the doctor did to me after that, but apparently, whatever that looks like, I saw a video on it, but he pumped out my stomach. They they put a tube in through your throat, I believe, or is it in your nostrils? Somewhere they put it down into your throat, and they force you to throw up by putting, I don't know, something, maybe it's charcoal, or they put something into your system to make you puke. Or they have a certain pump or something that pumps out anything that's inside your stomach. Maybe it goes right down into the stomach, something like that. Anyway, I don't remember any of that. So I had passed out. But the whole time, until I woke up in the morning, I remember being in a black room. It was like a black room. Nobody was around anywhere. It was like I was walking around and there was nothing but darkness and blackness all around me. Maybe that's because it wasn't my time to go and therefore I wasn't allowed to see anything. Not sure, but that's what happened. And anyway, I remember waking up in the morning and I felt really sick and nauseated. And it's like 10 in the morning. And I remember my mother being there and the doctor walking in the room when I woke up, when I first woke up, and he said to me, if you'd have showed up 5 minutes later, you'd have been dead. So that's what it felt like to drink too much. Don't recommend it. It's not fun. Anyway, that's that. The second one was when I had a miscarriage. The night before it had happened, before I went into the hospital. Was it that night or was it that morning? I called that night. I started having these severe cramping. And I called my doctor because you had a direct line when it comes to pregnancy or whatever. I had this direct line, and they said that I called, and the doctor said, you can come in if you want, but there's nothing we can do to save this pregnancy. You know, you might as well just wait till morning. So that's what I did. And I just happened to have my 3-month appointment the next morning. My husband had to go write a test or something, and he just didn't happen to be home at that time, so I couldn't leave my baby with him. So I had to take my son in with me to the hospital in Texas? In Texas. And I happened to know where it was. I got in the car the next morning, and I told my husband, I said, I think we're losing our baby. But why would he believe that? Anyway, got into the car, had my son's stroller and everything, and I walked in with the stroller in a lot of, I was very uncomfortable. Walked in, had my appointment, and the person that was examining me put their hand inside of me down there and pulled out a little tiny fetus of my baby with their bare hands. And when they pulled that, they severed something inside of me, and blood started coming out of me at a rate that was like pouring a glass of milk, I guess. They basically said they had to prep me for surgery, and that somebody had to be there to pick up my son before they could do anything, as I was sitting there dying right there in front of them. They didn't have any daycare or anybody to take my son to watch him, so, until my husband came, nothing. And so I had to stay alert. So I had him on my lap, I remember, and I didn't understand why. The doctor said, that there was supposed to be a nurse that was supposed to be by my side, talking to me, keep my mind off of what was going on, making me not worry, I guess. And I kept feeling this gushing feeling underneath. They put a few towels underneath me, and then they had me in a wheelchair, and they wheeled me out with all the other pregnant mothers that were outside in that room, which was kind of traumatizing because they were all having their babies as I was losing mine. And they didn't even have me in a back room, right? So I was right out there among everybody in like a hallway type of situation. And sat there, and the nurse was talking to me about everything. unrelated to what was going on. And at the same time, they threw a whole bunch of paperwork that I had to sign. I had to do like 10 or 15 pages to give them permission to give me surgery, insurance, and all that kind of shit. And the cramping was so severe that I was like, on the edge like that, and it hurt so bad. And every time I would do that, about every 2 or 3 seconds, I'd feel another gush coming out me. There was blood all over my towel. But I seemed fine. It was like my defenses were up or something. Finally got a hold of somebody. I did happen to have a number, and they were friends of my husband's, and they came to the hospital. And I remember the elevator doors opened, and we were wheeling out there because they knew that they were running out of time with me, that I had to be rushed up to emergency very quickly or else I would die. I was basically bleeding to death. And I remember we wheeled over to, because I said they should be here any minute, we wheeled out to where the elevator was, and the elevator doors opened, and my husband's friends came out. They grabbed the car seat and my son, and they said, we'll take good care of him. And we'd known him in the military for years, so it wasn't like they were strangers. They just happened to live in the same area that we were. So then I remember the elevator doors close, and then the next thing that happened was within 5 to 10 seconds later, my vision was gone, and I just said I can't see. So that was the first thing that went, was my vision. And then I felt really nauseated, like I wanted to throw up, and I started kind of heaving, and I couldn't see, but I could hear the whole time. At that point, the hearing was the last thing to go. And then I remember passing out. Next thing I know, I was laying on a gurney or somewhere in the operating room, and there were specialists, the operating doctor and the nurses and everybody else there were all looking over me, calling my name out, because I guess they had to stabilize me before they could put me out a second time in order to do the surgery to, laser the bleeding or fix the miscarriage or whatever that was happening inside of me. And that's what happened. Then they said, you're going to be fine. And then they put me out. So that's what it feels like to bleed to death. It kind of goes like that, but it does happen pretty quick. Once you're out, once you pass out, you don't feel anything. Didn't remember anything. I didn't feel any pain. I didn't feel nothing. Like I was just gone. So that's the good news. So it's almost like you get taken from your body and lifted to a higher level or something, and you're just, slab of meat or whatever. Like, it means nothing. Don't feel anything. No more suffering. Really quick. So that's when that had happened. That's what that felt like. The third time. Apparently I didn't come close to dying, but I knew what it was like to be experiencing the drowning. It was really hard. There's a lot of anxiety attached to it. I was flapping my hands and kicking all over the place, and a bunch of people came down in a tag, and they landed in the pool when you're going down the water slide. And when I came down, there was no space of the water for my tube to go, so I went under my tube and then under everybody else, underneath all their tubes, and I was submerged by water for several seconds, and I kept kicking until finally, like 20 seconds later, I came up gasping for air in between somebody's legs is what had happened. And like an idiot, I didn't hop on their tube to go down. I was too afraid to go down with anybody, but I was in like a scared mode. That had happened to me, so I know what it feels like to be underwater and not be able to get up. It is terrifying. It is actually the worst way to die. Drowning is the worst. It's the scariest, it's awful, and it takes a long time. And you're aware of everything the whole time, for a long time. So I went through that, almost drowning when I was quite young. The fourth thing that happened to me was I took two different kinds of sleeping medications. I had mixed them. I just had two pills. And I remember my doctor, I was really tired and I wanted to sleep longer than usual because the psychiatrist wasn't coming to talk to me when I was admitted into this mental hospital. She wasn't going to see me till the next day, and I couldn't stand it. I felt like I was on the edge, and I couldn't handle the stress level. And so I just wanted to put myself out. That's all I wanted to do. And I thought if I took two pills that I would just sleep twice as long, which is what I wanted, and that nobody would bother me and everybody would leave me alone, is what I thought I was going to do. And so I knew that they were in class, a lot of the people that I hung around with or that were living among me, and I knew that that was the perfect time for me to take a couple pills. I set up my mattress so I wasn't laying flat by putting something underneath the mattress like a chair or something, and it looked like my bottle was empty because I, had taken too many pills, but I didn't. It was actually empty because I was getting a brand new bottle of pills, and I had those in my locker locked up. So I took the last couple of pills, and next thing I know, there was people. I remember going to sleep, and the next thing I know, I guess my roommate showed up, which I don't remember. And then there was the psychiatrist that came running down the hallway, apparently, and a couple of nurses, and I don't know, a bunch of people were in there, and I just remember them yelling at me, and they were yelling like crazy, Julie, Julie, wake up, Julie, Julie, can you hear me, Julie? And they kept doing that. I remember that was the nurse at first, over and over and over again. And I remember them banging around trying to say, look at this is here. Why is this seat here? Why is she all propped up in that bed? Why is this bottle empty? Oh my God, what is going on here? And they started freaking out and they kept yelling at me louder and louder, wake up, wake up. And then I remember them kind of slapping around at my face, trying to wake me up. And then they started getting more aggressive. And they started pinching me, and I didn't feel anything, but the whole time I could hear them talking to me completely clearly. I heard everything that they were saying, and I thought that I was purposely ignoring them, like making it look like I wasn't responding to them. That's what I thought I was doing, but I don't think they would have bought that. I think they would have saw if I was actually in there, so maybe that's how it felt to me. And I thought it was funny inside my head. Like, I was thinking to myself, why can't they get me to respond? Like, I must be really good. I must be really smart. And screw them and everything else. And I remember rolling over to my one side there, and then one of the male nurses comes up, and he says something really ignorant in my ear. After they tried to put something cold on my feet because they try to wake you up with your feet, and I still didn't move. Really, like ice. They put a bag of ice or something on your feet, and they do everything they can to wake you up. Because when you mix your medications, you can go into this coma state, and apparently they can't wake you if that happens. So there's a very short window of time for them to save you and to snap you out of it. And I remember my family doctor telling me that I could take as many sleeping pills as I wanted, but it wouldn't kill me. It would fuck me up and I'd get really sick, but it would never kill me. So I wasn't worried about two pills. But I didn't realize that I shouldn't have mixed them. I had two different kinds. And mental illness drugs are pretty powerful. And I didn't have much of it at all. And I remember hearing the psychiatrist saying, she shouldn't be unresponsive like this. It shouldn't be like this. The medication, that she took or whatever, it shouldn't be affecting her or whatever, and she was confused. It took them about 20 minutes, and finally this male doctor came up to me, and he was the most ignorant fucking thing, I swear to God. I think the only reason why I snapped out of it was because he pissed me off, but he came into my ear and he said something really ignorant to me and offending and offensive. At least that's how I took it. And he was like threatening that he was going to, I don't know, do something. And then all of a sudden I remember making a movement, and then I hear a nurse saying, she's waking up. She's waking up. She's moving, after he had whispered something into my ear. And then, you know, before I started moving, it was the psychiatrist was about to give up and say, call 911, call an ambulance, and you know, somebody come and get her, because she didn't think that, you know, they were going to be able to wake me. Anyways, I heard that, and as soon as I heard that, and I heard that fucking nurse whispering in my ear, all of a sudden it's almost like I forced myself to snap out of the whatever mode that I was in, and I forced myself to move an arm or something, and then they were like, she's waking up, she's waking up. And then I remember opening my eyes and looking at them, and then they started getting pissed off at me. The nurse looked at me and said, you really worried me, you scared me, you know, and where's your medication? And then when I told them that it was in the locker and I'd only had a couple of pills, they were like, what the fuck? They couldn't even believe that I was in that state. But I don't need much medication in order for me to sleep for hours and not be able to be woken up. I don't need much at all, just like baby doses, like half of the lowest pill of the lowest dose is all I need. So 2 of those just set me over, I guess. And they were all concerned and worried that I had overdosed, I suppose. So when I woke up, they asked me a few questions, and then the doctor says, come in and check her blood pressure, every 20 minutes for like the next hour or something. And then I remember getting up. I remember putting my slippers on or socks or whatever and walking out like nothing had even happened. So that's what it was like when I took too many of the sleeping pills. One was a Seroquel, and there was something else. I don't remember what it was anymore. Anyways, you do strange things when you're overwhelmed and you're that tired. And when you went through the course that I went through in the 2.5 months, it really took a toll on all of us. And so I was just the next one in line. That's what happened. So those are my stories about my near-death experiences. And I hope that it helps some of you out there to understand what it's like. You know, it's never the death, I think, that we fear the most. It's the suffering, getting to that point where, you know, there's the death. But my doctor, Kimberly Mora, told me that the best way to go is kidney failure, she says, because you go into a coma state and then you just go right to sleep. She said that's the best way to go. The worst is definitely drowning. I knew what it was like to be under the water, and it was terrifying. But I think like anything else, eventually you just pass out too. And then once you pass out, then you probably don't remember anything after that. But it's not very fun. That's it. That's all the things that I've experienced. So, yeah. Hope you all take care.